Hello, and welcome to the Center for Simulation-Based Learning's Orientation Video Series. To make each learning opportunity as valuable and meaningful as possible, it is important that you understand the capabilities of your patient simulator, along with the expectations for your actions during a medical simulation. This video will introduce Laerdal's SimBaby, a computer-controlled, full-body, high-fidelity infant mannequin. It has realistic anatomy and clinical functionality that allows for a variety of medical assessment and intervention techniques. Changes in the simulator's physiologic state rely on a simulator operator to observe and manipulate the changes appropriately. These changes may be observed on an accompanying clinical patient monitor that will display appropriate vital sign tracings and values, including electrocardiogram, oxygen saturation, and arterial blood pressure monitoring. SimBaby has a wide array of features that include the ability to produce different sounds, an anatomically correct airway, spontaneous breathing with chest rise and fall, measurable cardiac rhythms, and other clinical signs. Embedded beneath the skin are a series of small speakers that produce normal and abnormal heart sounds and lung sounds. Corticoff sounds may also be heard when taking an oscillated blood pressure in the left arm. SimBaby may also produce vocal sounds such as crying, hiccups, or coughing. 3 pulses can be palpated on the simulator at the brachial, radial, and femoral sites. The pulse strengths are variable depending on blood pressure. Care must be given to apply gentle pressure, as too much force will eliminate the pulses. The SimBaby has a pulse oximeter that can be attached in the usual fashion. Oxygen saturation levels will be displayed on the monitor. Attaching a 3-lead ECG to the simulator's connection studs will monitor cardiac rhythms. To defibrillate, attach the leads to the metal posts located on the mannequin's torso. Do not use adhesive pads as you would in an actual defibrillation. When performing CPR, compressions will generate palpable pulses, and compression artifacts will be visible on the patient monitor. Proper airway maneuvers, such as head tilt chin lift, should always be performed, as SimBaby is able to replicate several airway complications. As SimBaby has an anatomically correct airway down to the level of the bronchi, a number of airway adjuncts may also be inserted, such as an oral or nasal airway, an endotracheal tube, or laryngeal mask airway. The simulator will also allow for gastric tube insertion. The mannequin may present with tongue edema, pharyngeal swelling, or laryngospasm, and failure to properly place an airway may result in right main stem intubation with unilateral chest rise, or stomach distension. Seesaw respirations and retractions may also be visible. You may also experience variable lung resistance and compliance when ventilating. A tension pneumothorax may be relieved by performing a needle decompression at the appropriate site. And a chest tube may be inserted on the mannequin's left side only. In simulations involving trauma, active bleeding may be present and should be controlled as you would control any other bleed. An intravenous line can be started in the right arm, through which fluids can be infused. Intraosseous access is also possible through the tibia in both legs. Drugs may be administered through any of these sites. Several clinical signs will also aid in the assessment of SimBaby. The simulator may present with torso motion and has interchangeable pupils that may be normal, constricted, or dilated. A distended fontanelle can be palpated in simulations, indicating elevated intracranial pressure. This concludes the video orientation for the SimBaby Patient Simulator. Please note that every effort should be made to accompany this video with a hands-on training session with an experienced simulation instructor. We hope that you have both an enlightening and engaging experience.